Welcome back to Port Huron Hospital's Today's Health Program. I'm speaking with Dr. Timothy Lucas about common causes of shoulder pain. Dr. Lucas, it seems that you deal with a lot of problems related to the rotator cuff. Let's talk about that for a moment. What is the rotator cuff made of?
The rotator cuff is actually made up of 4 tendons, that are basically helping compress the ball against the socket. The rotator cuff, let me show you on the model here. The 4 tendons of the rotator cuff, there's one in the front, the subscapularis, one in the back, and then 2 on the top. The 2 on the top are the ones that are most commonly affected with both tendinitis and tears.
What happens to the rotator cuff that actually causes the pain?
There's a couple reasons for pain with the rotator cuff problems. One can be impingement, where the rotator cuff tendon actually impinges or catches on the undersurface of the bone here, or a spur, depending on the patient's anatomy, as the patient raises their arm up and out. There's also, if the rotator cuff tendon is torn and is pulled off the bone, it can actually cause a leakage of the joint where the cartilage in the joint is exposed, and that causes pain.
If you suspect a rotator cuff injury, how do you diagnose that?
First, getting a good history from the patient, finding out when their pain started and how, doing a thorough physical examination, obtaining those special x-ray views, potentially even doing a diagnostic injection to see if the rotator cuff is the issue, as well as obtaining an MRI to define whether there's a tear of the tendon.
And how do you treat initially? How do you initially treat rotator cuff problems?
A lot of times rotator cuff problems can be treated conservatively, even if there is a small tear. I would start initially with anti-inflammatories. Sometimes resting for a while can help with the acute symptoms. Sometimes one injection of cortisone to get over the acute inflammatory phase can be helpful. I don't recommend repeated injections because even though cortisone is a good medication, there's such a thing as too much of a good thing. Too many injections of cortisone can actually cause thinning of the tissue and cause people to be prone to tears. So one injection is usually the place to start with that. In addition, physical therapy to work on a structured, regimented program to work on stretching and strengthening for the rotator cuff can be quite helpful.
If these initial treatment options are not successful, what are the surgical options available?
Surgical options for rotator cuffs, historically rotator cuff tears and tendinitis, those issues have been addressed with open surgery, where you actually go in and take a portion of the muscle off to get inside to fix the rotator cuff tear and to take that bone spur out. The most exciting thing with orthopedic surgery these days is things are becoming more and more advanced. We're able to do those surgeries now arthroscopically. We make small stab incisions, quarter-inch incisions, to get inside with high-definition cameras to take a very close look where the tear is, find that tear, repair that back down to the bone into where it tore off of the bone to promote the healing process and to get people back faster than they would have otherwise. With the open procedures, with detaching the muscle, you actually do more trauma, so people have to heal from that additional trauma in addition to healing the repair.
In having this arthroscopically done, about how long does it take to heal and to get full use of your arm back?
Certainly everybody heals at a different rate, but in general, with arthroscopic surgery, with small tears, patients are tending to heal 6 to 8 weeks. With larger tears, it does take longer to heal because you have to balance healing the tissue with regaining your function and your motion.
And how does that compare to having the open surgery?
The open surgery, much more painful, which can limit and inhibit the rehabilitation process. It makes things scar together more and makes people more apt to have problems in the initial phase after the surgery.
Dr. Lucas, we need to take another break now. Stay with us. When we come back, we'll be with the physical therapy department at Port Huron Hospital.